everybody, it's Hilary Cragg here. Today I'm going to talk about vascular dementia, what exactly it is, and how it's caused and what impact it will have on people with the dementia. So it's actually not just one condition, it's an umbrella term that's used to describe a number of different conditions, but they're all vascular based and they all have an impact in damaging the brain. So it can be caused by either large or smaller strokes, but it needs to be a number of them over time, which then is progressively damaging to the brain. Or it could be caused by what's known as small vessel disease, it's basically damage within the walls of the arteries and veins and blood vessels within the brain. That can either cause damage within that part of the blood circulation system within the brain, or it could be small bleeds. So the point is it's actually a number of different conditions, but as I said, they're all vascular based. Now what they do, and what's a key part of it and why it's not a stroke, and that it's a dementia, is that there need to be a number of them and they need to be happening over time. Because people can have just a one-off stroke and then they're considered to be stroke survivors rather than people living with a dementia. But people living with a dementia, one of the crucial aspects of whether a condition is a dementia is that it progresses over time. So whatever the particular form of vascular event that's happening for people with vascular dementia within their brain, there need to be a number of them and they're happening over time. So the general presentation for people who have these vascular events is that their presentation is actually quite stable until they have a vascular event, and then they immediately drop. Because whatever the event is, it's usually quite rapid. It can happen within a couple of seconds. And then from there's a tiny little bit of recovery as the brain and the body adapts to living with this new level of damage, and then it levels off until the next event. And then it goes through that pattern again and drops off the cliff. So how somebody might know themselves is that they will feel very unwell when they're having an event, and then immediately afterwards they feel quite sleepy, or just generically quite unwell without really being able to be clear as to exactly why they don't feel great. And then the recovery period usually takes between 1 and 2 weeks, and then to the extent that they're going to recover, it will be done usually within that period of time, and that's when they plateau again, and then they'll feel normal again. But over time, they would recognise that there's a loss of their abilities and their functioning, so they might think that they've forgotten something, or they're forgetting, or they're in some way losing some ability. And how it presents all depends on which part of the brain gets damaged, because different parts of our brain control different aspects of our abilities. So it could be that language, it could be remembering, it could be understanding, it could be even walking or hearing or seeing. So sight, there are all sorts of things that within the brain that could be damaged, and it's always quite unclear what will be damaged with a vascular event. But often it is issues around remembering and understanding. So the treatment for dementia, or vascular dementia, is actually the things to do with controlling vascular heart disease and vascular disease in general. So not drinking too much, eating well, exercising, and very particularly keeping blood pressure down, and keeping cholesterol down, and all those lifestyle things. So there is no specific medication for vascular dementia. But the medication that can be given to people who have vascular dementia are those medications that deal with the various kinds of vascular disease. But of all of the presentations that create problems with vascular disease, high blood pressure is considered to be the most important of those. So managing blood pressure is really important. And I really hope that's helpful, and I hope it's interesting, and I look forward to seeing you again soon. Thank you very much for listening. Bye for now.